How's everybody doing? Dr. Gilson here. I'm really excited to have an awesome guest today, a good friend of mine, Dr. Stacy, and we are going to be talking about all things holistic and functional pediatric dentistry. We'll be touching on some adult stuff too, but she's a pediatric dentist, and that's where our focus is going to be today. So really looking forward to that. Going to give her a few minutes to jump in here. It's been a couple month hiatus, so excited to get back on here. And there's Dr. Stacy. Let's get her in here. Graham, there we are.
What's
Stacy,
up, Seth?
how we doing?
Living the dream, man. How are you? Happy Friday.
That's my line.
Yes.
Everybody asks me that in the morning, and that's my answer.
Yeah. Did you work today? Do you work Fridays?
I do.
Yeah.
I do. I know you don't, correct?
Well,
Or sometimes you do.
I don't see patients,
Okay.
but I'm working all
Yes.
day. But I'm
There's,
doing
there's,
like
oh,
my other stuff.
yeah. That's the actual work part.
Yeah, yeah. So like I do my social media and lectures and all of that good stuff. But
all,
yeah, it's
all
been good.
all that jazz.
Hi everyone. Thanks for having me.
Yes, of course. It's a pleasure to have you on here. We've talked about it in the past. We've had some pretty cool conversations in the past.
Yeah.
Um, and I don't want to take up too much of your time, but I'm very appreciative and grateful for you to be on here. And I want to thank everybody else that's already on here and jumped on and listening. So thank you all very much for that.
Yeah, sorry, I'm like frazzled. So give me a minute. Whew.
That's
Hi,
okay.
everyone. You're in Florida, but where in Florida are you?
South Florida, Hollywood, Florida, technically.
Oh, fun. And so
Yeah.
what's the weather like right now? 70s?
Um, Today has actually been the first day it's rained literally all day,
Oh,
like since last night to now. It's still raining. So,
is there
but no,
flash flooding?
I'm sure there are, or
Yeah,
I'm sure there is. But
yeah, yeah.
the neighborhood around me has been pretty flooded since this morning. But
Mhm.
I haven't heard anything specifically about flash flooding just
Yeah.
yet.
Well, rain's good.
Yes.
All right. Well,
So
here I am.
let's get started.
Dive on in.
Yes. Thank you, everybody, to again joining on here, The Art of Mindful Medicine, episode number 29. I am Dr. Seth Gilson, a holistic and functional dentist, certified yoga teacher, speaker, and personal coach. And my lovely guest today, as some of you have already heard, is Dr. Stacy Whitman. And let me tell you a little bit about Dr. Stacy. She is on a mission, and I love it, a mission to create a cavity-free world by taking a whole body, holistic, and functional approach with her patients. If there's nothing else you know about Dr. Stacy, that's the opening line right there.
I love
Her,
it.
her dentistry and practice philosophy is grounded by science, empowered, and love, which I love that line, by the way. Dr. Stacy attended Tufts University School of Dental Medicine and initially worked as a general dentist, eventually going back to school, earning a certificate in pediatric dentistry from Oregon Health and Sciences University. She has always been passionate about children's sleep and airway health, focusing her research and residency on how to improve airway assessment and diagnostic tools in the pediatric population. So important. In 2019, she founded NoPo Kids Dentistry with a mission to take a whole body approach to dentistry. She became a diplomat of the American Board of Pediatric Dentistry in 2012 and is a board certified pediatric dentist and a fellow of the American Academy of Pediatric Dentistry. She is also involved in many organized dentistry groups, including the Holistic Dental Association, the International Academy of Oral Medicine and Toxicology, the International Academy of Biological Dentistry and Medicine, the American Association of Ozonotherapy, which we're going to talk about that,
Yeah.
and has her certification in laser proficiency. She has taken numerous courses and trainings in children's sleep and airway medicine, studying oral myofunctional therapy, craniosacral therapy, and is a Breathe Institute ambassador. Dr. Stacy is an internationally certified health and wellness coach, as if all that other stuff wasn't enough, from the Institute of Integrative Nutrition, and is currently attending the Institute of Functional Medicine and the American College of Integrative Dentistry and Medicine with an expected certification in 2022. She dreams of a world without cavities or airway sleep issues and believes in motivating families to join her as a team, keeping their children healthy and thriving with small, manageable daily changes. Awesome stuff you're doing. I'm like,
That
right?
was a lot. Sorry, man.
No, that's perfect. I mean, that's how people get to know who you are.
Yep.
I mean,
In a
that's,
nutshell.
yeah. All right, so let's dive into it. All that's absolutely beautiful and fantastic, and we're going to talk about a lot of that stuff in this hour. But I always start with gratitude. So if you could please share with us, Stacy, 3 things that you're grateful for today.
Oh, I love this. I'm always grateful for my health. I really try every time I wake up in the morning to say that to myself, like how thankful I am to wake up and feel well and be able to easily get out of bed, and have the ability to move about my day without much issue. I'm very grateful for my family. My little girls are just the apple of my eye. They, if you're a parent, there are struggles and the struggles are real, but those beautiful moments are so beautiful. And it's been really cool watching them grow up. So I'm very thankful for that. And I'm thankful for having like-minded colleagues like you
Ain't that true?
to motivate me, because I always had it in my heart, even since dental school, I'd say, to practice the way I am. But I didn't have the courage to do so because I really thought I was all alone and just kind of a wackadoo out here. And what would my colleagues think, and all of that. And then I realized, no, there are many other providers out there questioning how we are practicing dentistry, and looking to optimize patient care in different
Mhm.
ways. And so I respect you for that. So thank you for
Of
being
course.
here.
Absolutely. We are on the same page. And it's interesting because um, a lot of people think that it's, they're like, they hear like holistic dentistry or functional dentistry, like, what is that? And I'm just like,
Yeah.
it's dentistry.
Yeah.
There's just a different approach to it, which we'll get into.
Hmm.
But I've totally agree with you. And like, that's the beauty for me. That's the way I like to use social media, is to connect with like-minded individuals that are really just not trying to go so much against the grain, but trying to explore more and see what else there is more out there for to offer people.
Totally. Yeah. I just think, yes, it's not so much to go against the grain. We have to have a traditional training to do what we do, right? And I practice dentistry in a very similar way in many ways to other pediatric dentists, but then there's a lot I do that's different. And a lot of that is connecting the dots.
Mm-hmm.
To me, it really means I'm looking beyond the tooth. I do find dentistry is very myopic. It's very micro. It's like the tooth,
Yeah, it's
maybe
narrowly
the mouth.
focused.
And it's like, what is the margin of the tooth, and what is the anatomy of the tooth? But it doesn't take into account the fact that these organs are connected to the rest of the body, and how is what's happening in here impacting the rest of the body. So even though my specialty is like neck and above, if you will, I need to know how my area of specialty could impact my patient's overall health. And I need to be able to have conversations with them about that and support them and guide them, because that is truly optimal wellness. Like, I can fix a cavity in a tooth, but who cares if they have rampant gum disease or periodontal disease or all of these other issues? And what's really cool about dentistry is you go and see your dentist generally twice a year. So we really see and interact with our patients a lot. We have a huge opportunity to help them toward healing. And
100%.
so much is seen in the mouth. I mean, it's just not cavities. You can see, I mean, you know this, but like nutrition deficiencies, microbiome imbalances, gut dysbiosis,
100%.
so
We're
many
gonna
things.
we're gonna get into all that stuff,
Yeah,
all of it.
cool.
So, or we're gonna try and get into all of it anyways.
Yeah.
Um, but I want people to know a little bit about you first. So, where are you from? Where are you practicing now? Tell us a little bit about your childhood and your experiences growing up.
Sure thing. So I grew up in a pretty rural part of Maine, um, and I had a pretty Great childhood. From what, as a child, I had a great childhood. In hindsight, there were complications, but I was outside a lot. And my parents were really into like gardening and cooking from scratch and things of that nature. Um, but there was a lot of substance abuse in my home, and there was like a lot of mental illness. And I didn't see that as a child, but in hindsight, I did, and it definitely has propelled me into wanting to live optimally.
Mm-hmm.
Um, and let's see, I fell off my bicycle when I was 10, and I suffered a really, really gnarly bike accident where I broke my maxilla, I knocked permanent teeth out. I was pretty laid up for a while. And so that's where I was first introduced to dentistry, because my dental providers were so nurturing and caring and literally put me back together again. So I paired my love for science and now dentistry with my love for art. I kind of was an art kid and started out as an art major, and I kind of put all that together, and I ended up in dental school. And as you know, like, dental school is very traditional. You have to do that normal training. You really do.
Yeah.
And I practiced. I didn't like it. I really didn't. I actually, sincere, I like was really miserable. And then I practiced as a general dentist, and I was still miserable. And then my mom very suddenly passed away from cancer, and it was a lot of lifestyle influence. And she had significant mental health, and she didn't have community. She didn't have sense of purpose. There's just a lot to unpack there. But again, that really prompted me to say, no, I don't want this for myself, and I want to learn more about environmental toxins and living cleanly and holistically and getting back to the basic, and looking towards like ancestral health and evolutionary health of humans too. So that's where I really started piecing some of these things into the way I practiced. But even still, I thought, geez, I need to get really, upstream. And how do I do that? Well, it's with kids. That's the only way that I can get the most upstream and have the most influence over their path and their journey, is before the disease even begins. Like, I want to educate and teach and support parents so that these children don't grow up with dental disease and, all of these needs and this dental fear and everything. So then I thought, okay, well, I'm going to go back to pediatrics. And I did that. And it was very traditional again. And I practiced as an associate for a while. And I still wasn't quite happy because I couldn't practice the way I truly wanted to. And that is when I stumbled across The Dental Diet by Dr. Stephen Lin. And I had already read Weston Price's work, but I was just fearful to just kind of create this visionary practice. I was too afraid. And,
Mm-hmm.
and anyway, I met a bunch of like-minded colleagues, and that book really opened my eyes to say, wait a second, there are many other providers out there who are dissatisfied with dentistry. And I don't know if you've read it. I assume you have.
I have, yeah.
But his intro, I was like, oh my God,
Yeah,
this is exactly me. He like left dentistry. He hated it. He went on this pilgrimage through, he was like traveling, and he found Weston Price's book. And I mean, it was so similar to my experience.
the way he found it too was pretty cool.
Yeah. So I was like, hot dog, I'm going to do this. So I revamped my practice. Totally.
Beautiful.
And it's been amazing. So, yeah.
I totally relate. We'll definitely get into that more in another conversation, but it is funny hearing, and when I had the same kind of revelation when I read his book, and I'm just like, okay, I'm not crazy. I'm not the only person that goes through this, or it makes total sense. And one of the things, go ahead.
Oh, you go ahead.
No, I was just going back because you said it a couple of times. So like the traditional training that we've all had to go through as dentists, that I want everybody to realize that is a very firm foundation that we all have to go through. And then that's why dentistry and medicine in general is a practice. You continue building layers on top of these foundations, and you have to have that strong foundation in order to discover things like what we're talking about and what we're going to talk about here.
100%. I couldn't agree more. Yeah, I think part of the concern is, we are science-minded humans, like that. We want it to be backed by data, and unfortunately, like holistic,
Sometimes to our detriment.
well, often for a detriment, because we're not taking in clinical experience and patient experience, into our calculations all the time. It's not all black and white, right? But yeah, anyway, it's cool. We don't want to get so holistic. It can be so overused, and there are so many negative associations with it, and it's really hard. Like, you want to be liked and respected by your colleagues. So that was what was hard for me, is I didn't want to be pegged as this woo-woo provider that, what is she doing? Some like voodoo magic at her office. No, I mean, that's why I said it's science that's, grounded in science and founded with love. And it's really important to me that everything I do, there's data, there's research to back it up, but it's
100%.
just looking outside of our traditional guidelines and how we are traditionally taught. Functional medicine is too, right?
Yeah.
So,
yeah. And continuing education, all these things you're talking about is so important. That's why I was at a big ozone conference all day yesterday down here in Miami. Yeah.
Where were you?
It's called the EB Hotel, but it was for like O3 ozone therapy. It was a conference.
Was it Frank Schallenberg?
Yeah.
Nice.
Yeah, it was really cool. Really, really cool. There was a bunch of really cool speakers. Met some people that I've read about and just haven't had the opportunity to meet. We'll talk more about it, because ozone is just unbelievable, and all completely research backed, and like,
oh my goodness,
it's just so underutilized in medicine in general, because it's not just for dentistry. It's used in medical, like hospitals as well.
It was used for COVID treatment.
Yeah.
It's used a lot more in Europe and like South America. The United States is so far behind on so many things, that's a whole other topic. But ozone is hands down the best thing I've added to my practice.
For sure.
No argument. The best thing I've added. Yeah.
Before we dive into that, though, I do want to switch gears a little bit. And there's this concept of mindfulness that I lived through and has become pretty popular, actually, that I've noticed over the past few years. And I'm curious as to what mindfulness means to you.
Well, I want to always be present. That's really important for me, is to, especially when I'm with a patient, to be very present with their energy. So this is when you can listen to me saying this and you're like, that's so woo-woo. But it's not. Like, if you give yourself a moment to be still and present, you can pick up on another human's energy. I mean, that's proven, right? So being mindful is being really attentive to the bio-individual needs of my patients. And for me, it's not only my patients, but it's their parents. Because their parents are bringing in a lot of fear, their own personal trauma, guilt, and they feel judged, they feel shamed, so for me, being mindful, at least with how I practice, is just trying to every time be extremely present for that individual patient and their family, because their needs may be completely different from another child's needs that may have the exact same issue.
For sure.
But I need to approach it in a very different manner. I think a lot of that is lost in medicine and dentistry because it's so often now turn and burn. So I do try to clear my mind before I step into each room, before I see a patient. Even if I'm in a rush, I really try to just take that moment to just clear my mind so that I can be present. And I know I have 1,000 things waiting for me out there, but I try to just turn them off. Because we owe this to our patients. And I mean, there's the medical and dental model.
Oh, audio went out. There you go.
I forgot to do not disturb.
Oh, it's okay. It's
Uh,
all good.
I was rushing. Anyway, yeah. So being present, I would say, to my
Yeah,
patient, because
for sure.
it will serve them more.
Yeah, 100%. And I'm at the practice that I'm at, both practices actually, I'm the only one that sees kids.
Oh,
And
cool.
yeah, and I
Move
can
to Portland. Be my associate. I need an
yeah.
associate. I'm serious. Come
We'll
on.
talk. We'll talk.
Okay.
um, but I mean, I mean, a lot of times these kids that come in, this is their first experience of the dentist,
Mm-hmm.
and I mean, I don't want to say they're terrified, but they are very skeptical of what's going on there.
Yeah.
And they sit down like it. I mean, I don't even talk to them about anything except I just try and play with them and talk to them for at least the first few minutes that I'm with them,
Yes.
just to try and
Yep.
get them to open up. And you can really see a lot about the parents through the child without even saying a word to the parents.
Absolutely. Well, I mean, so when I was an adult dentist, what bummed me out so much is how much dental trauma there is in fear.
Tons.
And I couldn't take it because I am a feeler and I
Mm-hmm.
feel other people probably more than the average person. And it just was getting to me. I was like,
Mm-hmm.
whoa, everyone hates me. And they don't even know me. But it's because of past experiences, many that they had as a child. And I was like, this does not have to be this way. I do think many aspects of dentistry are pretty aggressive. There's a lot of over treatment, in my opinion, especially with kids. And so I just thought we could make a paradigm shift, essentially. So
Yeah.
here I
Yeah.
am.
No, I totally understand. I agree with you. In the past, it has been very difficult to deal with. I didn't so much feel like hated or anything like that, but I mean, for 60 to 70% of the people that you see in a day, every day, to be like hyper nervous and just or filled with anxiety and just like not wanting to be there, and you trying to go over certain health aspects with them can be very challenging,
Yeah.
emotionally, mentally, physically. Like it can weigh on you a lot. And that's where I really kind of dove into understanding myself more, first of all, and also the difference between compassion and empathy. And there's a
Yeah.
huge, it's a slight difference, but it's a huge difference. Um, and
Explain definitions. Let's hear.
I'm sorry.
Explain the difference to
So
you.
to me, I mean, empathy is essentially, I mean, that care and that desire to want to help somebody, but
Mm-hmm.
it's in addition to those things, it's taking on those feelings from
Yes.
somebody else as your own.
Mm-hmm.
And to me, that's what can be draining.
Yeah.
I mean, if it's like a best friend and like they're going through a hard time, it's like, okay, that's one situation. But day in and day out, seeing
Yes.
people like, I don't know what you see, 10 people a day, sometimes 15 or more people a day, and at least half of them have these kind of traumas. It's like,
Yeah.
it can, I mean, you can't take on all of that.
It's compassion fatigue. Yeah.
So, well,
Yeah.
and then to me, compassion is it's understanding what's going on with somebody and that desire to just want to help them,
Yeah. I love that.
and not taking on that feeling or emotional burden that they feel all the time.
Yes.
And you can, and that's really the main difference to me. It's just not taking, it's the same thing, just not taking on that energy.
It's
And
hard.
again, like
hard.
talking about energy, it is, and you have to, I mean, I find that being really grounded and centered in myself
Mm-hmm.
always helps. And then of course there's the self-care practices and self-love practices that we have to go through, that everybody has to do. I think we just have to be really, really intentional about it.
Yeah, I think it comes with age and wisdom too, because
Yeah.
I'm getting much better at it. Like when I was first out, I just took on everyone's issues and baggage, and it was a lot. I was not well because of
Yeah. I mean, one of the things that really affected me was hearing the stories.
it.
And
Mm-hmm.
I'm just like, I couldn't imagine being
Yeah.
any kind of doctor, but obviously a dentist in this situation, doing what they're talking about was done to them as a kid.
I know.
It's some of the stories I've heard, and I'm sure you've heard, are just wild. So I love that mindfulness complete presence, and whatever you have to do to kind of zen yourself and get into that space. So tell me, what are some of the practices that show up for you in your life, and I mean, other than what you just said, I mean, how do you really incorporate them into your dental practice?
But like functional practices or mindfulness
Well,
practices?
mindfulness practice. What are some of the things that you do for yourself?
Oh, myself mindfulness.
Yeah.
Well, I definitely am into yoga. I just went to this killer restore class earlier today. That was wonderful. So I'm really into that. I like to move. I'm a mover. So I
Hmm.
need my body every day. I prioritize that. I really try to sweat every day. So whether that's through a workout or sauna or sun, um, and again, this has come with age, but I definitely put myself first now, which I never used to. I was like way on the list, down on the list. But I try to have a meditation practice. I'm gonna be honest, I'm not great at it, but everyone's meditation is different.
For sure.
So for me, what I have found the most successful is I like to run. I'm a runner. So I like to go out without any music, no podcasts, and that's sort of my meditative state. Um, and I take baths a lot, so that's like I do what I can,
That
but
all sounds good, pretty good to me.
I would say movement is my most important
I
thing.
think moving meditation is works for a lot of people, to be
Yeah,
perfectly honest. As long as you're present in what you're doing, like you just said. So
yeah. I have work. We all have work to do, right? So I
for sure.
know I'm more sympathetic. I'm working on that, trying to calm down and recenter. But it's part of probably why I like pediatric dentistry too. It's like you never know what you're going to get. It's pretty exhilarating when you're in treatment. I mean, I like that
You got to be on your toes the
rush.
entire time,
Oh, yeah, you
for
sure do.
sure. I not that you don't with adults, but I think that's the biggest difference that I found with kids. It's like in just a split second, things can just completely change.
Oh my gosh, it's insane. It's like literally insane. I mean, I think it was just, I like block it out. I think it was yesterday. It might have been 2 days ago. There was this little girl. She was doing perfect. She sat through all the laser and like all of the steps. And this at the very last minute, we were just finally curing. She lost it.
Mm,
And who knows why? She just was over it. She was tired.
yeah.
She became aware, I think. Like sometimes we do use a little laughing gas, so not always, but sometimes. So I think sometimes that helps them kind of zen out, if you
Hmm.
will. And then all of a sudden she became aware of what was happening. I don't know, but we had to be like, ninjas. And it's
Literally.
stressful. It's not for everyone. It's
Oh,
definitely
for
not.
sure. I
So
mean that's why. I mean the last, even the place I left before. I mean, I think I'm the only one that I know in the last few places that I've been at that actually would see kids on a regular basis.
yeah, it takes
Like,
a personality.
yeah, it definitely does. It
Do
takes
you
a
know
lot of
what
patience.
I find? It takes patience, but what I find too, I bet why you can do it is because you are grounded too. I feel very grounded, even in a stressful situation.
Yeah.
I think that doesn't resonate with a lot of people. And I practice my deep meditative breathing a lot, like during these moments of treatment when things are going sideways. I'll like do my rhythmic Wim Hof breathing. You know what I mean?
Hmm.
So anyway.
Oh, I know what you mean. I'm a fan of Wim Hof and his breathing technique. So
Yeah,
for
cool.
sure. All right. So let's get into what you do a little
Okay.
bit deeper.
Okay.
So let's start off. Please explain in obviously from your point of view, what is holistic and functional dentistry, and kind of how'd you get on this path? I mean,
Hmm.
you said about a little bit before about how and why, but let's dive
Yeah.
in a little bit more.
Yeah. Well, I went on the path because I didn't feel like I was making a difference. So to me, I really want to optimize human health. That is like an important sense of purpose of mine. And so I felt like most dentistry is sort of end stage disease treatment. You
Hmm.
know, it's not really what's missing is the educational piece, which I'm really trying to prevent these issues from happening again. And also educating the parent, why did they happen? So essentially functional medicine and functional dentistry to me is like looking at the root causes of issues. And it's not just candy bars and soda. Like it's so much more than that. And like the oral microbiome is incredibly important. How we're breathing, how we're sleeping, our nutritional deficiencies, trace mineral deficiencies, and gut health, and how are we absorbing emotional health in the family, stressors, things like that. So that's where the holistic part comes in, because it's the whole body. So like
Hmm.
our patient intake form, it's not just about teeth. We go through each system, like from pregnancy. What was your pregnancy like? What was your birth experience like? Was your child breastfed? How is food introduced? What is sleep like? What is your child's gut health like? Do they have any chronic diseases? And I'm not asking that just to check the box. Like if they have eczema or asthma or some of these other chronic issues that I think get brushed over, I pause and I say, okay, let's dig deeper into that. Let's talk about your child's gut health, because gut and mouth are very interconnected.
Hmm.
And if your child is having gut dysbiosis or intestinal permeability or food sensitivities or anything like that, that could be why they're having dental caries or issues with how they're breathing, which can lead to hyperactivity, which can lead to ADHD misdiagnoses and effects with school and behavior. And then that affects the whole family. So um, that's it. I mean, we dive deep. So yes, my focus is here, but I want to talk to the family about how this impacts the rest of the body and how the rest of the body impacts this.
Exactly.
And yeah, and like really, really educating. I mean, I talk so much at these
Yeah.
appointments. There's more talking than there is like actual dentistry, but patients love it because I think we forget, but I mean, I don't know. Do you remember your first day in dental school? I was like, my mind was blown because I didn't have any dentists in the family.
Me
So
either.
I was like, what? Like, I remember thinking, wait, not everyone gets cavities. Wait, what is this? I was a lay person, and
Yeah.
we forget as we practice dentistry year after year after year after year, decade after decade. We forget most people don't dork out to research about teeth like we do,
Yeah.
right?
Yeah.
We need to bring it down to their level so we can educate them, because we're missing this education piece.
For
And so
sure.
patients just think cavities are inevitable. They're in my family. We're prone to them. They don't even realize how to prevent them, like truly how to prevent them or truly
Hmm.
causing them. So, and we do know if a healthy mouth means a healthy body.
For
So
sure.
it's not to create panic, but if your child has a bunch of cavities and abscesses and all of this, that is definitely impacting the rest of their body in some capacity.
100%. Yeah.
So,
And what I talk to a lot of people about, I mean, adults and children and the parents of the children, is that these aren't coming from nowhere. Like
right.
it's not just like a random act of God or something that they have all these cavities and abscesses and things like that. It's like, yes, and like, but they don't eat a lot of candy. Okay, but well, what is going on? Because I can guarantee you, there's something else going on in their body that you don't know about right now.
Absolutely. Yeah.
And go
And
ahead.
fortunately, a lot, especially with primary teeth, a lot of it can stem back from pregnancy. And now I mean, even arguably preconception, right?
Hmm.
So again, I hate fear mongering or like eliciting panic in anyone, but it is true, like your maternal gut health, your microbiome, your nutrient absorption and your diet, it impacts your child so much, including their dental development.
Hmm.
And it starts early, you know?
Yeah,
So yeah.
for sure. And then so you talked about a few of the things like education and philosophy and like certain approaches, but are there any other certain specific modalities that are different from holistic to like a
Sure.
traditional dental practice?
Well, I can just speak for my practice, but
Mm-hmm.
I do think I do things, we all do things differently. But a big focus of ours is definitely talking about nutrition and getting off this ultra processed food wagon that humans are on right now, and which is the fault of the big food industry, right?
Mm-hmm.
So really educating parents about that, because unfortunately, like, we're so on the go, we're so busy, and these companies market to busy, exhausted parents. They market to kids,
To the kids, yeah.
and so many parents think this is healthy. It says it's organic, or this says natural. But it's so educating, like, about crackers and pretzels and chips and granola bars and all of these things, and yogurts and things that just have hidden not only sugar but flours and seed oil,
The processed
food
flours and things like
dyes,
that.
things that alter the microbiome,
Yeah,
right? And that's the big thing that is blowing up right now. It's at the root cause of all of this is the microbiome. The root
for
cause of
sure.
all disease, right, is the microbiome.
100%.
So we educate a lot about that. It's eat the rainbow is our mantra for the kids, and we give a chart. We talk about how each color supports our body in a different way, and we make it exciting to fill out their rainbow chart every day to try a new food, because we want to try to encourage adventurous palates. I also really try to get families back into the kitchen and preparing food and starting that early. Um,
Mm-hmm.
the other focus I have is healing and reversing and remineralizing cavities, which they don't teach us in dental school, but it is an absolute treatment option for many patients, especially if you catch things early.
For sure.
And so we basically heal or arrest cavities a lot in these children to avoid these traumatic dental experiences, these unnecessary dental experiences, sometimes sedation, sometimes anesthesia. Um, and that's really cool. And the
Yeah.
parents appreciate it. What's very cool about the protocol I use is that we form a team with the family, and the family is very committed, because it takes commitment, right? It's a health journey, and that takes
Yeah.
commitment. But the families are on board, and if you make changes to your diet and your hygiene and your breathing and prioritize sleep and hydration and all of these things with your children, you see health benefits. And what's cool, they don't only see their cavities arresting or reversing, but they notice other health benefits too. The
For
child's
sure.
sleeping better, they're doing better in school, they're more engaged, they're eating a wider variety of foods. You know, their bowel health is better
Yeah.
too. So it's really cool.
But people should, I mean, I hope people are starting to realize, and if they're not, realize that changing one or two things can have an effect on five or six other things that are going on besides what you're actually looking at. And
Yep.
that's the magic of these things. All health, our health and our body is clearly interconnected. We're not just these separate organ systems. It's all connected. And like you said, the microbiomes are something that are really, really important. And I do want to talk about that, but real quick, because you talked about something a few times as well, in it's your passion of yours, and that's sleep medicine.
Yeah.
So can you kind of give us a little bit of an overview of what sleep and airway health are, the importance, and how it affects individuals and adults versus children, or if there's any similarities?
Yeah, well, I mean, so what I make sure I do in every single visit, and it's quite thorough, is a airway and sleep screening. Um, and we know that if you are a mouth breather, okay, which many of us are becoming mouth breathers for various reasons, you are going to probably be quite unwell uh,
Mm-hmm.
at some point in your life down the road. When we breathe through our mouth, we get less oxygen. Our nose is this incredible organ that many of us don't even appreciate. So it filters the air, it humidifies the air.
Mm-hmm.
It helps with nitric oxide release, which helps with cardiovascular health. You get more oxygen.
And it even purifies the air too. Like that filtration process
It's
is, I mean,
antiviral. There's immune functions in there too. Yes. So the other thing, if you breathe through your mouth, you're more prone to cavities. You're more prone to oral dysbiosis or just dental or an oral disease, gum disease. But with when we start doing this at a young age, it can change the way our face develops, the way our jaws develop, and that perpetuates issues too. So it can change our posture, our gait, and it affects our sleep, and then it just becomes this chronic issue.
mhm.
So part of my screening, I mean, I like to see babies, so I'm looking already for, like, is their tongue tied? Do they have a narrow high palate? We talk about habit elimination, how important it is to try to get rid of pacifiers at the appropriate age and to discourage thumb sucking if we can. And if a child's doing it, why are they doing it for such a
And
long time?
is that unique to the individual, the thumb sucking and the pacifier, or is there like a general age that you recommend that people
No,
stop
so
that?
fires, I definitely like to see gone past SIDS benefits, which is usually like 7 or 8 months old. So
Okay.
I sure like it gone by the age of 1, but to me, the sooner the better.
Okay.
Um, because the longer we suck on it, generally it is affecting the way your child's jaws are growing. It's
For
not just
sure.
tooth position, it's actually skeletal structure, and that affects airway. It also
100%.
creates low tongue posture. They're compensating with muscles they're not supposed to be. So it creates facial imbalances. It affects swallow pattern. Um, Sucking is very normal in infants, but at some point it should transition. And so that's where thumb sucking comes in too. It's kind of normal to a point, but then when it extends past a certain age, we want to know what the root cause is. And a lot of times
Hmm.
it can be because of like a tongue tie or an oral motor dysfunction. Um, there's a lot of important neural bundles up at the palate where if a
Hmm.
at rest, we release feel-good hormones like dopamine and serotonin. And so if a child's tongue can't get up there or they can't close their lips, they will figure it out. They do it themselves with their thumb. They push up there, and that's why they often do it to cope and to calm. So, again, a lot of this is just educating parents. Um, if there are orthodontic issues or airway issues, many times we'll recommend to see an ear, nose, and throat doctor. We might recommend to talk about like food eliminations, or are there food sensitivities? Very often dairy and gluten can increase sinus inflammation, sinus congestion. We talk about cleaning up the bedroom, like getting a really nice air filter in there, getting the pets out of there, a clean bedroom, not with a lot of clutter. And that's like the whole feng shui thing too. Like your sleep is your sanctuary. Like you should start that young with your children. Um, we will refer to early functional orthodontists, myofunctional therapists, craniosacral therapists, osteopaths, chiropractors, acupuncturists. It just depends on the need, but that can all be related to airway and sleep, as well as nutritional deficiencies. So looking into iron deficiency or trace mineral magnesium deficiency, that can be really related to sleep quality issues
For
too.
sure. Yeah.
So that is a huge component of our exam too, as we talk about that. And definitely, I mean, parents definitely, if they don't know why they're at my office, most parents specifically come to our office for a reason. But sometimes, like, I'll start asking about their child's like bowel movements and gut health and like how they're breathing at night, and the parents are like, "Why are you asking me? You're the dentist." So it takes a little education there too. So they,
Did you tell them that the tubes are connected?
yeah, it's all
Yeah.
connected. Yep.
Yeah, for sure. So, some of the things that parents can start doing, I know you mentioned some of the things at home and stuff like that, but what are some of like the kind of modalities that you help them with in the office?
Great question. Well, just quickly at home, something to look for. So look at how your child is breathing. So, because a lot of times I'll ask a parent, does your child mouth breathe? And they'll say, no, I don't think so. Meanwhile, I've already watched that child for like 10 minutes and they're like,
Yeah,
the whole,
exactly.
but you just don't notice it. And
And it's
guilty.
funny, you just did the whole posture thing.
Oh,
Just opening your mouth, you just like
Yeah, it's fluoride.
And you see it too. It really makes a difference.
Well, I can tell when a child walks in. I
Mm-hmm.
can tell by their posture already. I mean, it's painful to go to airports now because you're
Yeah.
just like, oh my God, you're a mouth breather, mouth breather, mouth breather. Like you see it everywhere. You can't unsee it.
Yeah.
It's an epidemic. It is a big, big deal. Um, but if we catch it early with kids, we're saving them all these issues with like chronic headaches and neck aches and sleep apnea and all these things in adulthood.
For
But
sure.
something to look for as a parent, um, for sure, go watch your kids sleep. Are their lips closed or are they open? And are they snoring? Are they noisy breathing? Do they toss and turn? Are there lots of night terrors, nightmares, sleepwalking, prolonged bedwetting? Like, do they spin around in their sheets, get all wound up? Do they end up on the floor? There's a lot of grinding, breath holding. We think some of these things like snoring, we're told is normal. If you go to these sleep conferences, these children's sleep conferences, unless a child is sick, they say no amount of snoring is normal. That is a
Yeah.
sign of mild obstruction happening.
Yeah.
So if that's happening, we want to figure out why and how can we correct it early. Is it tonsils? Is it adenoids? Is it a tongue tie? Is it an orthodontic issue with space? Myofunctional issue, tone? So watch your child sleep. You know, really watch them. Are their lips closed? Watch them when you're driving in the back seat of the car. Are they gazing out the window with their lips open? Or when they watch TV? Another thing with older kids, are you constantly telling your children to chew with their mouth closed? So a lot of kids who chew with their mouth open, it's because they only can breathe through their mouth. They can't breathe through their nose. So they're literally chewing and breathing. And this is something many dentists need to realize. When you get that really panicky patient in your chair who's really struggling, a lot of times they might be mouth breathers.
Mm-hmm.
You are in their only airway space. I mean, talk about a panic attack, right? Some patients literally can't breathe through their nose.
Oh yeah.
And so is it like a septal defect, or is it, allergies? Are there polyps? Like,
Yeah.
again, this is where an ear, nose, and throat doctor usually will come in and help us figure it out. But
For sure.
so look for that. Watch your kids sleep. Watch how they're eating. Watch how they're breathing. It's important.
And when they're running around too and stuff, that's a good time to watch how they're breathing when they're
absolutely.
playing and things like that.
Yeah.
So another thing that you've mentioned, a term that you've mentioned a couple of times, the microbiome and dysbiosis and things like that.
Mm-hmm.
What is the oral microbiome? How does the food that we eat impact it? How does that impact overall health? I mean, are there foods to eat and foods to avoid, things like that?
Sure.
And I know we talked a little bit about processed foods and you want to eat the rainbow, but
Yeah. Okay, so the microbiome, there's many different microbiomes in the body. Humans are more microbial than we are human. I always forget the ratio, but it's significant. We're many more microbial cells than we are human cells.
mm-hmm.
So there's about 700 of species that we know of bacteria in the mouth. And I suspect there's more. But the microbiome includes bacteria, viruses, fungi, it can include parasites, protozoa, like all the things that encompass us that are not human, but many of them are not harmful. They're not pathogenic. Many of them are very
beneficial. Yeah,
and we
exactly.
need them. There's that whole thing you remember from like Biology 100 of like symbiotic
Yeah.
relationships, right? You help me, I help you. And they do a lot for our body. And in our mouth, they help protect our teeth. The biofilm is actually what helps with calcium and phosphorus exchange.
Mm-hmm.
It helps regulate the pH of our mouth. I mean, there's so much, and we're just still uncovering a lot of this. But we're so accustomed to, or, the past few decades, like sterilizing everything, disinfecting everything, these mouth rinses with heavy alcohols and, essential oils that are just stripping the microbiome. It's like kill, kill, kill. That is not good for us. And so that are doing that often are in some state of dysbiosis. And that means there's more pathogenic bacteria than healthy or commensal bacteria. Okay. And we want good, I say to the kids, you want good guys, not bad guys. And I start teaching the kids very early that all germs aren't bad. There are good germs and there are bad germs. And we want more good guys than bad guys. And so how do we support our oral microbiome? So first off, nasal breathing. You know, if you breathe through your mouth, you dry out your saliva, which is very protected, but it also, the pH will drop. So harmful bacteria, they are anaerobic, they don't like a lot of oxygen, and they love acid. So they love this low pH. So they just thrive. They just have a party. You want a more neutral or alkaline pH in your mouth that's very hydrated to support the good bacteria. So nasal breathing is really important. Hygiene is important. To me, I think flossing is paramount. I would pick flossing over brushing any day of the week. I ask all of you, prioritize it. It's a non-negotiable. Work toward every single night of flossing. Your systemic health will benefit from that.
I tell that to every patient, adults and kids. It's just as important, if not more important, than brushing your teeth.
I really think it's more important. So almost all the cavities that I see, I mean, literally almost 100% of cavities in children are between the teeth.
Yeah.
It's not from not brushing, it's from not flossing. So I tell parents, start out with flossing. You've got to get in a good flossing routine. Use those little floss picks. I leave a bowl of them in the bedroom. We do it during our nighttime stories. I have tied 2 things into one. It's a parent hack. It works great, but it's a non-negotiable. It's just like you wear your seatbelt, you wear your helmet, you floss your teeth every night, because I want these kids to become adults who floss. They don't even think about it, because I don't want them to have gum disease or periodontal disease, because that leads to heart disease, diabetes, Alzheimer's, dementia, cardiovascular disease, preterm labor, miscarriages. I mean,
certain forms of cancer.
COVID outcomes.
Yeah.
And that's just the tip of the iceberg. We're learning so much more. So floss. Definitely, let's see what else. So be careful of the dental products that you're using. So many are marketed to disinfect the mouth. So I'm not a big fan of oral rinses for the most part. Most of them, I think, are stripping your microbiome. They're leaving you unhealthier than you started. I know they're marketing like killed 99.9% of germs and all this stuff. You don't want that.
You don't want that.
Exactly. You don't need that.
Yeah.
So less is more. So be very careful with rinses. Be careful with rinses. A lot of the traditional toothpaste, you need to be very careful with too. So to maximize uptake of particularly fluoride is what most of them have in their products. You need to have a very acidic pH. And so a lot of these big name toothpaste, when you actually test their pH, they are acidic. The toothpaste is acidic. So you know how much we talk about, like, be careful with lemon water, but meanwhile we're brushing with an acidic toothpaste every day. Yeah. I mean, it's mind-blowing. So you have to be so careful with your products.
Yeah.
They have emulsifiers and surfactants and all of these chemicals that are damaging your microbiome.
Foaming agents, like there's just so much, like,
totally.
Yeah.
Yucky yuck. So that. And yeah, so eat the rainbow. So trying to eat more whole foods. So if you look ancestrally, and this is really true, if you look at human skulls from 10,000, 12,000 years ago, all around the world, there are samples that have been studied. There are very few cavities, almost no cavities. This is a very new disease to humans. It's happened since the agricultural revolution, and then even more so since the industrialized revolution.
Yeah.
Where we started making flour and milling grains, and sugar was added to everything, and everything streamlined, in fact, mass produced.
Yeah, processing food.
Yeah, and soft, and we don't have to chew it, and it dissolves in our mouth. So that's when cavities have skyrocketed. So it is a very, in the grand scheme of humans, it's a very recent issue. And it's all because of our diet, and it's all because of processed foods, or ultra processed, I should say.
Yeah.
So trying to eat more of a whole food diet, trying to steer clear of things in bags and boxes, crackers, pretzels, granola bars, chips. And so I don't believe in like all or none, but just being mindful of it. So maybe not offering a lot of that stuff in the home, knowing that your kids are going to get it at soccer practice or after school or at a friend's house, right? I'm a big believer in like the 80-20 rule. Like you just do the best you can most of the time. So that's really important. Trying to steer clear of things that are really acidic, you know. So you want to be careful with like coffee and lemons and things. And I'm not saying not to have them, but if you do, try to rinse with water after. You can do baking soda rinses, which will raise the pH. It actually can help kill yeast. And I do love fermented foods too,
That's
because
huge.
that's really important. So those are the live probiotics. You know, fruits and veggies are the prebiotics that we need to feed the probiotics. You know, a wide range of nutrients is important. Like vitamin D3, K2 is critical. Omega-3s are critical. Trace minerals are critical. So, yeah, just
Totally.
trying to
There's a lot. I know.
there's a lot. I know. But here's the cool thing is that what is good for the mouth is good for the gut. What's good for the
100%.
gut is good for your brain. What's good for your brain is good for your joints. I mean, it does streamline it that way, right?
For sure.
So, yeah.
For sure. That's where it comes back to like the domino effect, but in the good way.
Correct. Yeah.
So, and another thing you mentioned was reversing or arresting caries. Can we really do that? How does that work briefly? And why is it that more dentists aren't discussing offering this to people?
Okay. Yes, it can be done. I do it every day in my practice and have for years. It does take commitment from the families, and you have to catch the dental disease early. So that's why it's really important to see a dentist. But you know, our mouths are constantly our teeth are constantly demineralizing and remineralizing all day long. So every time we put anything into our mouth that isn't water, the pH lowers, digestive enzymes come out. It's part of the digestive process, right? So when the pH lowers, it's in an acidic state, it breaks our food down, but we do lose some minerals out of our enamel then. Okay, so then if we pause and we're not snacking all day and we give our mouths a rest, ideally, I like about 2 hours between meals. The pH will buffer and it will rise back up again. And in that, the pH carries calcium and phosphorus and all this good stuff, and it pushes that stuff back into the teeth with the help of the bacteria that is part of our microbiome. Okay?
That creates that biofilm that you were talking about.
That creates the biofilm, yeah. So there's dips in our pH all day long, right? We just want it to be in homeostasis. So we want the demineralization to match up with the remineralization. And what happens with the cavity is when there's way more demineralization and your body just can't remineralize. So what we do is, part of my protocol is we go in and I need to clean house. Okay, so I need to get rid of all the bad bacteria that are in there, because if you have a lot of early cavities or demineralization, like pre-cavities, it's a sign of dysbiosis. So we need to go in, and that's when I use ozone. And so we use ozone gas to kill the bacteria, kind of start clean slate, and then help the patient rebuild their healthy microbiome. I do love hydroxyapatite toothpaste. That's like calcium phosphate. It helps strengthen. There's so much research to back up that it does remineralize. Hygiene has to be on point. You have to be nasal breathing. If not, we need to unpack that. We do talk about various supplements too, like a D3K2. Trace minerals are very important. Hydration is very important. We need to get gut health under control. So there's quite a bit to it. There's actually this really cool product out right now. I'm going to post about it soon. It just launched. It's called Bristle. It's a at-home microbiome test.
Interesting.
It's cool.
That's like the only one. I've ever heard of one.
I've talked to the founders. I'm like, you guys are going to be billionaires. This is amazing. So they're not marketing to kids yet. I might help them figure that out. But I'm going to be posting about it. So follow me if you're interested in it. But it's direct to consumer. And so I have a kit. I'm going to do it on myself and see what it's all about. But at the very least, it's so inspiring that it's like, it's happening.
For
Like,
sure.
it's happening, which is really cool. So the other thing we talk about with patients, it's important to know your vitamin D levels. I'd like to know your omega-3 levels, your magnesium levels. And so sometimes we do have kids get tested. We have this little finger prick test that parents can take home and do themselves and get results with, but that all impacts your dental health too. We do frequent follow-ups, but very often we almost always see 100% success unless the family comes back and is like, we haven't been doing anything, you know, and they own it, and that's fine. You know, you have to cut out like the ultra processed foods. You have to get rid of a lot of the crackers and pretzels and things. It's not forever. It's just through the healing stage.
Mm-hmm.
A lot like when you're trying to heal your gut. Like, you have to be very strict for a certain amount of time until you have healing, and then you can start incorporating things back in again.
Yeah,
So
one of the things I told people was that, I mean, you got to be where you're at over a pretty significant amount of time.
yeah,
You're not going to just heal and reverse that in an instant. You know, there's no magic pill for these things. You have to be consistent, and you have to have a little bit of discipline with things. I mean, if you want to heal, because again, you were talking about supplements. You can take all the supplements you want, but if your gut's having issues, you're not going to absorb them properly.
correct, absolutely.
So,
And you have to be sleeping well, because sleep is foundational.
sleep is from everything that I've read and heard from other practitioners just like yourself, the sleep is equally, if not more important than nutrition. Like the number one thing, like, I mean,
I would argue more. I think it's when I look at it like a pyramid, I'm like, sleep is at the bottom, and for sure. Because you could be eating incredibly healthy, and what if you're up all night with insomnia? You are not going to be healthy.
For sure. You can exercise, you can eat really well, but if you're not sleeping well, your hormones are going to be off, your circadian rhythm is going to be off. Your body's not going to have that regeneration or that healing capacity, because that's what kind of happens when you sleep. Yeah.
And the cleansing that happens in the brain, all of it, getting the toxins out. Yeah.
For sure. Detoxification is a huge thing while you're sleeping.
Yeah.
I know we're getting wrapped up, but I mean, we talked a little bit about ozone, and somebody asked a question about ozone, whether it's a free radical or some other form. And there's a lot of debate out there, and like you said, it's not really widely used or accepted in the U.S. But what is ozone, and like how does that work for people?
So ozone, the way you generate it is it's a O2 molecule.
And that's oxygen, everybody.
There's a molecule, sorry. And there's a machine that we have that pulls apart the oxygen molecule. So there is a very disordered O molecule floating around. Basically, it's O3. It's very unstable. It's negatively charged. What it does is almost everything pathogenic in the body is positively charged. Mm-hmm. So it will find that positive charge, whether it's a bacteria, a virus, a parasite. It breaks the cell wall, and it essentially creates like a peroxide, if you will. This is the same process that happens in our body during
100%. That's how the white cells defend you.
This is exactly what happens in our body all day long. People just don't realize that. Ozone gets a bad rap, I think, especially because we hear like the ozone index in like LA or like these places. The reason they do that, ozone is very easy to measure. There's going to be more ozone around if there's more pathogens in the air, right? So it's that smell that you smell after it rains, or like
by the ocean.
Yeah, yes. So you have to use it safely, meaning you don't want to have your patients inhale it, because it can be irritating to the lung tissue or the eye tissue. I've never had an issue with it whatsoever. You're just cautious with it. It's just like in dentistry, you don't want your patients swallowing half the stuff that we use, you know? So I will say they're doing really cool stuff with ozone IV and rectal and all of that. So we're just wanding it topically. The child, it's not going into their body. Right. It's sucked down. It's just touching the bacteria in the mouth. So it's really safe to use.
I mean, for canker sores, herpetic infections, and reversing caries. I mean, I saw some really cool cases yesterday of people using ozone, leaving a prep open, and allowing the cavity to arrest itself. I mean, or allowing it to just kind of heal after doing the ozone treatment. And it's really cool stuff that is being done out there.
Yeah, I'm getting away with a lot of deeper fillings that I might have had to do like a root canal in. And so now I'll just leave like a layer of affected dentin and like just ozonate, and it's hugely successful. I mean,
Yeah.
again, if you guys are really interested, go on PubMed or NIH and just search ozone in dentistry. There was a really cool study that came out 2 months ago that shows cavity reversal using ozone and hydroxyapatite, which is exactly what I do at my office. When I saw it, like, yes.
Yeah.
And so I'm trying to get approved by the IRB too to have a research study done at my office. Because I am
Awesome.
I've heard one of the only pediatric dentists in the country maybe using it right now.
Oh yeah, there's very, very few dentists actually using it.
Yeah, here in the U.S.
Yes, in the U.S.
Yeah, but anyway, I'm a big believer in it. It's amazing.
Yeah, I mean, I've been made a believer about it, even if I was doubtful. I mean, you can't really deny the tons and tons of research about it and the clinical cases that people show you. So
yeah, and you know, it's really cool with gingivitis, but also periodontal disease. So we're taught in dental school, like once you lose alveolar bone, forget it. I've seen crazy cases where they've done like ozone trays and the alveolar bone regenerates. I mean, it's unbelievable. But
it really is.
You think about it, the body does innately want to heal. It wants to thrive. It just needs help sometimes, and that's what ozone does. It's just help expediting what the body already does. It's giving it a little boost.
Exactly. 100%.
Yeah.
So I want to be respectful of your time. I really appreciate you. I'm just going to wrap up with a couple other things. Would love for you to share one of the most memorable or inspiring stories you have since you started practicing dentistry.
Oh, my kids inspire me all the time. I think one of them was I had this little girl, I'll never forget her. Her art's actually framed on the wall in my office. She had Apert syndrome, which is, it's a pretty serious syndrome that she was born with. Her mom had been through the ringer with her, and they had just never been treated very well, and no one was listening to the mom's needs. This mom was exhausted. This child had you know, a dozen surgeries, you know, and it was just really stressful. And she just wanted to be heard, you know, and she just kept being told that her child has to have anesthesia. She has to have anesthesia and have her teeth fixed. And the mom was legitimately scared about anesthesia because this child was very high risk to undergo anesthesia, like high risk. And so I just sat and listened to her, and we came up with a plan. But I'll never forget, like, she cried and like was so appreciative and thankful, and like they're just such a beautiful family, and they still reach out to me and her daughter's much older now, but I think it was just such a powerful lesson for me that I needed to get out of my own ego and my dictatorship as a provider and really just be there as a sounding board and just listen to my patients. And so that just really influenced how I always treat every patient. Is I'm there, you know, doctor is teacher, docere. I'm there to teach and to listen and to support. And I really do like to consider that we're on a team. You know, I'm not the boss. The parent, in theory, the parent is the boss. This is your child, and I'm just here to give advice, essentially. So,
the power of presence is very, very much underappreciated.
Yeah, agree.
So, all right. In closing, fun little question, kind of to wrap things up. If this were the last time you ever had to share your thoughts, and you could only share 3 things that you think people should start implementing immediately in their lives to improve their health, what would they be?
Okay, on the spot. Prioritize sleep. Get your sleep under control, and that might mean investing in like an Aura ring, some metric. I'm a big believer in I don't like the word biohacking, but I really do like having metrics to gauge health. I mean, that's why we have labs. You know, we take blood draws. So just understanding your sleep. I think it's really important. I think if you can get your sleep under control and also your breathing, you will feel so much better as a human. That it's just so foundational. I would also say just hydration. Most of us are walking around extremely dehydrated, but add trace minerals or salt to your water too. Again, these are little things. They're free. Sleep is free. Water is pretty free. And then I really want everyone learning to cook, even if it's something simple, getting back into the kitchen, just having a few easy meals that you can whip out just so that you can know what's in your food. But also I just think there's so much love and creativity with creating a meal for you and your family that isn't always appreciated. I know we're such a society on the go, but if you're not able to do that, learning to read ingredients. So I don't care about calories and macros and all. I'm not a bodybuilder, but learning your ingredients. And it's important to start teaching our children that too, because these big food companies, they're really out to get us. It's all about the buck. And they're hiding stuff now. They're renaming sugar. I mean, there's like...
Yeah, there's a lot of labeling issues.
It's so many labeling issues. It's out
the
of
fact
control.
that I don't even have to label like the percentage of what the ingredients are.
I know.
Is just...
And there's some
that's
left off the label if it's not a certain percentage. So,
yeah.
you know, I think learning to read ingredient lists, trying to make sure that you can pronounce and you know what it is. And also just finding companies that you trust. Like really, you have to be sort of an investigative journalist these days. I mean, it's a lot of work, which is why I have a platform I do, because I know everybody's busy and tapped out and overwhelmed. So I'm trying to take some of the load off from people.
Ditto.
Find people that you can trust. They're trustworthy, that it's not fear-mongering, and it's science-backed. It's, you know, really utilize humans in your life that are part of your community, that you can trust. I think is really
sure. For sure.
Yep.
Okay. So, everybody, thank you for watching. I really appreciate you for coming on here and joining our little talk here. And Dr. Stacy Whitman, you can find her on Instagram, and that's at Dr. spelled out _ Stacy with an I. So at Dr. _ Stacy. Are there any other outlets people can find you or reach you at?
Yeah, I mean, if you're in the Pacific Northwest, I'm at NoPo Kids Dentistry. If you need a dentist, I do have patients that travel really far that to see me, so that is an option. I have a website too. It's drstacy.com. I'm doing a little bit of reconfiguring things, but in 2022 there's a lot of cool stuff coming out. I'm working on a book, and I have a cookbook, and I have some courses coming out. I have a course for parents, and I have a provider course that I'm working on too. So
love it. If you need help and support, let me know. And somebody asked about a meal. So you heard Dr. Stacy's coming out with a recipe book. So there you go. You just be on top of it. Follow her for the meals. Okay.
I a lot on my Instagram too, especially in my story. You won't see much during the week because I'm so frazzled, but on the weekend
you're doing things.
I cook and, like, meal prep some because I enjoy cooking. It is an outlet for me too. It's a creative outlet. I enjoy it, but I share a lot of meals and what I feed my kids and things on my platform too. So yeah.
Beautiful. I love it. So everybody, again, thank you. I always welcome comments, feedback, suggestions. You can check out all the other episodes on YouTube, The Art of Mindful Medicine, or on my website, www.mindful.doctor. Of course, we're always on Instagram Live for these interviews, and I always like to announce it at least a week before when we're going to have the next episode. And as always, I end with a quote. This is one of my favorite gentlemen alive these days, and the quote is, "What you aim at determines what you see." So pay attention to where you aim your goals, and that's where you focus. So again, Stacy, much love. I appreciate you so much for coming on here. Thank you very much. Of course, it's my pleasure. And everybody, thank you. I hope you all have a great rest of your day. And I will see you guys soon. And remember, stay awesome, stay mindful. Stacy, I will see you and speak with you soon.
All right. Thank you. We'll be in touch.
For sure.
Bye, everyone. Thank you.